Okay, so now we're going to practice a few images. So I'm going to give you a second here to look at this, try and determine what you think you might be looking at. So we're looking at a picture of a canine shot that has a lot of vertical angulation error, but this is the anterior region. As we go back to the posterior. So what we see here is the nasal fossa and then the maxillary sinus over here. So this is the nasal fossa. Here we have a couple different things happening. So this is a maxillary film. This is a molar. Looks like it's the last molar in the arch. So that would make that the maxillary tuberosity. This little thing coming up in the corner, that would be the coronoid process. And then this thick white band over here, that would be the zygomatic process. Down here, this little radiolucent dot is going to be our lingual foramen, and the genial tubercles will be around it. And then this is the inferior border of the mandible there. And then I think you can sort of see the mental ridge along here and here. This big radiolucent area here is going to be the submandibular gland fossa, and this radiopaque line is going to be the internal oblique ridge. Sorry, I'm not giving you time to guess. I got to pause more, sorry. Okay, so what do you think these yellow arrows are pointing to? It's kind of a U shape or a J shape. It'd be the zygomatic process. And what about this thinner radiopaque line? Maxillary sinus. Kind of goes along the posterior teeth there. Okay, so now we have this long, thin radiopaque area. That would be the septum, the nasal septum. And then this sort of diamond shape area here, or a V. That would be the anterior nasal spine. And then what about this radiolucent line that's in the middle that comes all the way down between the central incisors? That's going to be your median palatine suture. Median palatal suture. And then what are the big kind of radiolucent areas on either side of the septum going to be? It's the nasal fossa. Here and here. Okay, so here, what's this sort of radiopaque area right here? That's going to be the mental ridge. Kind of the bone's a little bit denser there. What about these two white radiopaque lines, pretty straight looking lines? That's the mandibular canal. And then what about this kind of radiolucent area along the molars? That's going to be the submandibular gland fossa. Okay. So this was supposed to be a game, but we can't play a game. So instead, what we're going to do is I'm just going to name them for you. I'll give it a minute. I'll actually probably try to make a activity for you guys to do for a lab activity where you name the dental material. So we'll just go through here and talk about what we see. So the area that's really radiopaque, very radiopaque areas on x-rays, that's going to be very dense metal, and so that's amalgam. So here we can see a lot of very white, dense metal. So we know this is all going to be amalgam here, here, here. Even this one looks like it's probably amalgam definitely here and here. But what about this one here? So this one we see a very white area, but then we can see what looks like more like natural, almost like tooth. So how do they get amalgam underneath the tooth? Well, they don't. This is a metal fused to porcelain, so they call it a PFM. Porcelain fused to metal is actually what it is, PFM. So underneath the structure is a metal structure, and then they top it with porcelain to look like a natural tooth. Sorry. Okay, so this next one, this may be a little bit confusing. Someone might think it looks like decay, which could be that there's some recurrent decay, but these kind of whiter outlined areas here, and then the darker, it's a liner. These are composite material. So they used to make composite material that was real radiolucent, so sometimes it was hard to tell whether or not it was decay or not. So then they'd add these liners, these kind of radiopaque liners, to kind of identify that they are actually a filling material and not decay. They don't use this type so much anymore. So here we have, again, you can see that these are really well formed. So really well formed, very radiopaque objects are usually crowns, because amalgams, you don't get such defined lines. So these are all probably full gold crowns or full metal crowns. And then this little bitty thing here is probably a pin. Sometimes they, if they do a build-up, they have to use pins to kind of help build up the understructure of the tooth before they put on the crown. Here we can see this is the outline of a tooth that was prepped for a crown. So you can see sort of the prep part of the tooth, and then the actual crown is very radiolucent. And so you can't see, it doesn't show up very well, but you can see sort of the liner and the prepped area. So here, this is another metal crown. You can see the lines are very distinct, but you can tell that this is a stainless steel crown. This is something that they oftentimes use if it's a temporary crown, or they may use them on kids because you don't want to put a really expensive crown in a child's mouth, so a lot of times they use stainless steel. And you can tell it's stainless steel because the margins are very sharp and not well contoured to the tooth. So these are kind of a one-size-fit-all, so they just find one that fits the best and plug it on, whereas a crown that's made out of ceramic or a cast metal crown is going to have really smooth margins. They're not going to come out real boxy like this. So this is supposed to be more of a temporary fix, not a permanent crown. And then we have some amalgams, different amalgam fillings along here and here. And then this right here, you can tell this is metal, but it's just surrounding the tooth. So this here is a band for ortho treatment. So it's an orthodontic bracket or band. And so they must have had their wires removed so that they could have some work done or something, because you can see they don't have a wire, but this is an orthodontic band or bracket. And then this looks like some floating ghost teeth. So what do you think that is? I think we saw this in an earlier image. These, this would be a denture that the patient left in when they took the x-ray. So this is a denture. So you can just see the floating teeth. And then these are amalgam. Here's a little margin that's not very smooth. That can be a little plaque trap, cause recurrent decay there. Here we have a little piece of something metal. It looks like a wire. So either they maybe had some surgery, or it might have been obviously put there on purpose. But this looks like some kind of a little wire that somehow is down embedded in the tissue. So I don't know if they did that on purpose or if that's an accident. I'm not sure, but it's definitely wire and metal. Here we have just some kind of little artifact that you can tell is something metal. So oftentimes they call this an amalgam tattoo, and it's little tiny bits of amalgam that gets embedded in the tissue. And sometimes when you see it not on a radiograph, it looks kind of like a bluish dots, and it usually is just the amalgam just somehow got sort of embedded in the tissue during the process, and it shows up on the radiograph. But in the just clinically, it looks like kind of bluish, like a tattoo almost. And then here we can see this is not nearly as radiopaque as the amalgam, but it's different than enamel. So, and it has kind of some prepped lines. And so this is a composite restoration. So you can see how it doesn't follow the natural lines of enamel. So it sort of shows it's a prepped area. You can see a little bit of a gap here between the composite and the dentin. And so this is more of what a composite restoration will look like. Here we have a porcelain fused to metal bridge. These are the abutments, and this is the pontic in the middle. The pontic is the part that sort of is over the area where there's no tooth. And then the abutments are on either side. And then here you see a post. So this is, they had a root canal, and there's a post, and it helps with the buildup of the tooth so that there's something more to grip. So we have a bridge. Here's, you can see another bridge, another 3-unit porcelain fused to metal bridge, or it could be an all-metal bridge because I don't see anything on the top that looks like tooth colored. And over here, it's not highlighting it, but here you can see that there's something down in these canals. So the pulp area doesn't look radiolucent here. It looks a little bit radiopaque. So that indicates that they've had a root canal over here as well. So this is a crown with root canal. Because normally you'd see a radiolucent area down in the root canal, in the canals, or of the pulp, the nerve canals, but these are radiopaque. So you know that there's been a root canal there. This is looks like a space maintainer. They use this when kids exfoliate their baby teeth too young and their permanent teeth haven't come through. They prop up the teeth on either side, or else if it's too long of a time after the tooth has exfoliated, then the teeth can tilt and fall into the space. And so they use this to maintain, they call it a space maintainer, because they're maintaining the space for the permanent teeth that will erupt into that space. So it's metal, and it's usually put on both sides and then kind of dips down into that space to keep it open for when the teeth erupt. Here we have a little tiny piece of a broken instrument for someone who is going down into the tissue here and scaling the root, and the tip broke off. So this is probably the end of like a Gracie instrument. And it got thin, and they were scaling, and it broke off. So we have little retriever instruments in the clinic. They're magnet, and you put them down into the pocket, and it kind of just grabs it, and you pull it right out. But you have to take an X-ray to make sure that that something that hasn't been left in there, just to make sure everything is out if you break a tip off. And here is another example of a post. You can see it goes all the way down the natural tooth, and then here's some more of the root canal material, or the gutta percha. But that's a post. So that's an endodontically treated tooth. Here we have another tooth that's had a root canal, but instead of a post, all of this radiopaque material is called gutta percha. It's G-U-T-T-A P-E-R-C-H-A, gutta percha. And that's what they usually use in a root canal. And then they usually cap it off with either composite or an amalgam. And this tooth probably should have a crown, because there's still, you know, something going on here, and this is pathology. This is an abscess. So there's still something happening with this tooth. Here you can see all these little metal fragments. That's going to be amalgam that got embedded into the tissue. So there's all this little amalgam fragments, even all the way over here. Here's another image of gutta percha. You can tell because instead of the pulp looking radiolucent, it looks more radiopaque. Here we have a post, some more material for the root canal, and then this is a porcelain fused to metal crown. So the porcelain's down here, and then this is the metal part of the crown. And they call that a PFM, porcelain fused to metal. This is a dental implant. So the whole tooth is out. They've taken out the tooth, and they put in a titanium screw. So this, they make a hole in the bone, and then they put in this screw, and then the bone fuses with the titanium, and they bond together. And then after it's all healed and in place, then they cap it off with a porcelain fused to metal crown. And there's usually another third piece in here that's right in this area that's called an abutment. So that is the connection between the implant, and then there's an abutment, and then the crown goes on top of the abutment. But usually just looks like one solid piece, but it's actually 3 pieces: implant, abutment, and crown. But that's a dental implant. And that's the end of the show.